Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. Hi, I'm Dr. James Machino. Our topic today is premenstrual syndrome, or PMS as it's usually called. Now, PMS is a recurrent cluster of symptoms that often occurs 7 to 14 days before menstruation begins. Now, the signs and symptoms usually subside around the time that menstruation occurs. And also dysmenorrhea can be in there, which is sort of painful menstruation, which often is helped by the same factors that we're going to discuss today. Now, what is the prevalence of PMS? Well, about 1/3 of premenopausal women are affected, especially women ages 25 to 40 years old. But in about 10% of cases, the symptoms are recurrent and really severe. So the symptoms often manifest, as you know, in various ways. There's emotional symptoms that can be a factor: nervousness, anxiety, irritability, some mood swings, fatigue, lethargy, even depression. Some gastrointestinal symptoms: abdominal bloating, diarrhea, and/or constipation. There can be appetite changes, sometimes food cravings for things like sugar, salt, or chocolate. And then reproductive tissues can be affected: breast tenderness and swelling, uterine cramps, altered libido, and some other physiological manifestations like headaches and backaches and ankle and finger swelling. And of course, menstrual cramps or dysmenorrhea can occur in some cases. The most common symptoms are actually bloating, breast pain, ankle swelling, sense of increased weight gain, acne and some skin lesions, irritability, aggressiveness, depression, some libido changes, lethargy, food cravings. So what's behind all of this? What are the causative factors in PMS? Because it's so common and the symptoms are so far-reaching, such a cluster, such a constellation of things going on all at the same time. Well, a common finding in PMS is that there's an elevated estrogen to progesterone ratio that occurs about 5 to 10 days prior to the menstrual cycle beginning. And this is either due to too much estrogen floating around in the system, or estrogen not being detoxified efficiently, so now you'd have higher estrogen levels, or not enough synthesis of progesterone in the ovaries by what's called the corpus luteum. So let's break this down. What's the impact of a high estrogen to progesterone imbalance? When you have that imbalance, when that ratio is out of balance and there's too much estrogen, not enough progesterone, it's associated with a decline in brain endorphin levels. That may account for the mood swings that we see, the susceptibility to depression and anxiety. And excess estrogen may also elevate prolactin hormone, which then affects the breast, causing breast pain and even fibrocystic breast disease to some degree. Elevated estrogen can also increase release of aldosterone from the kidneys, and that then gets the body to retain more sodium and water, which can lead to swelling and bloating and weight gain that women often complain about. So what's the medical management? Well, none of these options, I think, should be the first choice. They often will give oral contraceptives or birth control pills, which are hormones that will override a woman's own hormonal secretion cycle. They can also give other hormones that will block normal cycles, or give women antidepressants or anti-anxiety drugs, sometimes diuretic drugs to get the water out, even painkillers for the breast tenderness and menstrual cramps. But the truth is that in most cases, the PMS symptoms can be managed in a more natural way using the right nutrition, lifestyle, and supplementation approach. And this should be the first line of treatment because there's no side effects to using these things. But there are many erroneous claims about what supplements to take and what lifestyle factors and diet to follow. So to separate the junk science from the real facts, that's what I want to present in the remaining part of this video. So what are the proven nutrition, lifestyle, and supplementation remedies that have been proven to work in peer-reviewed scientific journals studying PMS patients? So let's start with the nutrition strategies. Strategies that have been shown to work are switching to a low animal fat, high fiber diet. This will help to reduce circulating estrogen levels and bring things back into balance. Studies have shown that a low-fat diet alone can relieve some PMS symptoms. But when women lower their fat intake, say from 40% of their diet, which is sort of the North American standard, down to about 25% of their total calories, and they increase their fiber content in their diet from 12 grams to 40 grams, which is what we should be doing anyway, you see a 36% reduction in estrogen levels in the bloodstream. That helps to balance out the estrogen to progesterone ratio. We know that vegetarian women who eat less animal fat and have more fiber excrete 2 to 3 times more estrogen from their bodies and have a 50% lower level of estrogen in their bloodstream than meat eaters or women who eat meat on a more regular basis. So a lower animal fat diet with more fiber is a great way to bring the estrogen levels down. Other nutrition and lifestyle factors also matter. Don't smoke. Cut back on your caffeine intake and your alcohol intake so it doesn't irritate and cause overstimulation of some of the reproductive tissue. Certainly 2 weeks before menstruation, this would be a great idea. Get enough sleep so you're rested and your body is into the right circadian rhythms. And try to manage stress more effectively, even if it means using yoga or Tai Chi, meditation, starting a walking program, or being part of, getting involved in a hobby that makes you feel good or feels productive. And also endurance exercise helps to detoxify excess estrogen from your body. Exercise has been proven to improve PMS symptoms and to decrease the incidence of PMS. Women who exercise more regularly are less prone to having PMS in the first place. What about vitamin and mineral supplementation? Well, the best evidence is for vitamin B6 and vitamin E and magnesium and calcium, as I'm going to explain. So let's start with the B vitamins. More than a dozen clinical studies have shown that supplementation with vitamin B6 at the right dosage is very useful in managing PMS symptoms. Why? Because vitamin B6 is a cofactor for estrogen detoxification, so it helps the liver get rid of excess estrogen more efficiently. B6 is also required for enzymes in the brain that make chemicals that enhance your mood state. B6 also is required to make anti-inflammatory hormones called prostaglandins that help suppress the inflammatory components that may be related to uterine cramps and also breast tenderness and swelling and fibrocystic breast disease. Now, in some applications, B6 works synergistically with other B vitamins like niacin and folic acid and B12 and vitamin B2. So your best bet is to use a B50 complex as part of a high-potency multivitamin, as you'll see in the text below. Now, some studies show that B6 with magnesium is actually even more effective. B6 works together with magnesium in many enzyme systems in the body. So having about 200 milligrams of magnesium a day is also useful, which should also be found in a high-potency multiple vitamin. Now, vitamin E has also been shown to be helpful. Double-blind studies have suggested that vitamin E supplementation can reduce various symptoms in PMS, including nervous tension, headaches, fatigue, depression, insomnia, breast tenderness, anxiety, and even food cravings. Why is this? Well, we know vitamin E modulates the synthesis of certain prostaglandin hormones that have some of these effects, toning these things down, less inflammation, less irritation to tissues. It also affects the maturation of breast cells and uterine cells, and that sort of slows down the rate of cell division, so you tend to have less of these nodules forming and less irritation to these tissues. Vitamin E also regulates circulating hormones in PMS and fibrocystic breast disease. So vitamin E seems to have a modulating effect on many systems and has been shown to be helpful. Calcium and magnesium together have also been shown to be useful. About 1,200 milligrams of calcium, 200 milligrams of magnesium. Some studies show it reduces PMS symptoms quite significantly. What about herbal supplements? Well, I really like the combination of black cohosh with soy extract and gamma erosinol in one supplement. Why? Because I've seen it work, and there's good research behind it. Black cohosh contains these constituents called triterpene glycosides, and what they can do is increase progesterone levels. That's one of the things they can do, so they can bring that progesterone level up to help balance out the estrogen. But those compounds also tend to have effects on toning down the influence of too much estrogen on the body tissues. Sort of binding to estrogen receptors, it makes it more difficult for the body's more powerful estrogens to exert its effects. So the constituents in black cohosh tend to tone down the influence of the body's very powerful estrogens on breast tissue and other reproductive tissue, including the uterus. And so at the right dose and the right standardized grade, black cohosh has been shown to improve PMS symptoms in a lot of women, and I really like it. It's a very safe supplement. Same is true for soy extract. With the right medicinal yield of isoflavones, it's been shown to tone down the body's effects of its more powerful estrogens. And so these phytoestrogens in black cohosh and in soy can bind to estrogen receptors on the breast, on the uterus, and other tissues, And they have a very weak estrogen effect. So it slows down the proliferation rate. It just has less of an estrogenic effect. And by blocking those receptors, the body's more powerful estrogens can't get into those tissues and overstimulate them. So it sort of partially blocks the entrance of the body's more powerful estrogens from affecting those tissues, which in turn reduces the estrogen stimulation effect that's responsible for a lot of these problems. And isoflavones from soy have also been shown to enhance estrogen detoxification in the liver, bringing estrogen levels down into a more ideal range and blocking the synthesis of too much estrogen in the first place. But you need the right dose and the right standardized grade. Now, there's other botanical substances that women sometimes use that are useful, but I think they're dangerous. Angelica species, which is licorice root, or Angelica species rather, which is Don Quay, also red clover and licorice root. Some women use these things. My problem is that these herbs contain coumarins, and coumarins sound like the drug Coumadin, and for good reason, because they have anticoagulant effects. And they can then make your platelets so unsticky that you could have internal bleeding. And there's been some evidence that these herbs can lead to a propensity for some abnormal bleeding to occur. And so you do not want to have an internal bleeding problem from taking herbs. And also these coumarins create photosensitivity dermatitis. If you go outside in the sun and you have these coumarins in your system, you can get a very bad skin rash. And the use of licorice can actually raise your blood pressure over time and increase your risk of heart disease. So for me, the very best bet, the most effective thing, the most proven thing, and the safest thing to use as herbs to manage PMS, and it really works well, is the combination of black cohosh with soy extract and gamma-arosinol from rice bran oil. One last herb that's useful, chasteberry. Chasteberry is an herbal agent that's also been shown to be helpful in the management of PMS in really severe cases where all the other things that I talked to you about don't completely control it. Adding chasteberry may also be helpful. And for menstrual cramps, in addition to that, as I've talked about in other videos, chiropractic care can be helpful, and also chiropractic care with acupuncture can also be very helpful in controlling dysmenorrhea or menstrual cramps. Now, in the text below, I summarize the exact dietary and lifestyle plan that PMS patients should follow to help reverse this condition. As well, I outline the supplement combinations that will simplify the supplementation approach for PMS management. And those supplements are very powerful and very effective interventions. So if you suffer from PMS, I hope you found this to be helpful and will follow the recommendations. I know they will have a significant or make a significant difference to you over time. And if you know someone who has PMS problems, please forward this nutrition research update to them. I think they'll find it to be very useful. So thanks again for watching.